السلام عليكم. اسمي كريمة حبيب رضيوي العبودي من العراق، من النجف الأشرف. كنت أعاني من ورم سحائي متكرر في الجهة الخلفية للدماغ. كانت الأعراض عندي النظر كلش صعوبة، ضحك ما أقدر يعني أضحك، صوت عالي ما أقدر، يعني صعوبة كلش، حتى المشي يعني كانت عندي صعوبة. فإجيت عن طريق المترجم أستاذ مطهر المستشفى مانيبال الدكتور أوراك، فسوالي العملية، عمليتي فوق الكبرى، يعني استغرقت 12 ساعة. تحسنت عليها ووضعيتي كلش تمام هسه والحمد لله والشكر.
Mrs. Kareema came to us with a very large tumor on right side of her brain, which was covering parieto-occipital region of the brain, which means in the upper part of the back of right side as well as in the lower side. Now she had this tumor previously also. She was operated in 2014 in a different hospital, but this time this tumor came back again and it was much larger as compared to the previous tumor which she had before. So it was a challenging case because of two reasons. First is because it was a recurrent tumor, because there was already a surgery done, so there was a lot of scarring which has to be dealt with, and to remove the tumor without causing any brain damage is a surgical challenge. Second is the size of the tumor and its location. This tumor was in two compartments of the brain, which is the top one, which is above, and the below compartment. She underwent a successful craniotomy and re-excision of the tumor. We had to open both sides of the brain and remove this tumor completely. We did this surgery under neuronavigation guidance and under my operating microscope. She withstood the surgery well. We were able to remove this tumor without causing any damage to the brain. She started showing recovery very dramatically, and within overnight ICU stay, she was shifted to ward next day, and within few days she was discharged. I am glad that she is doing really well, and I am hopeful that she will have a disease-free time. Thank you.